one, educating them on those things. There's a lot of people that just don't really understand that physiology. But what does it really look like? We want to see you living to 83 years old, 90 years old, 100 years old, whatever that might be, but we want you to be healthy doing it. We don't want your decline to be at 75 and you live to 95 and have 20 years of not being able to do the things that you want to do.
Hey, Dr. Chris Gubles here with the Health Heroes podcast, and today we are here meeting with Dr. Brian Joyce at Sportive Chiropractic. So thanks for being on the show. Excited to be chatting with you today.
Oh, well, it's a pleasure to be here and look forward to having a great conversation.
Yeah. Well, it's interesting. I was reading your bio on your website, and I think similar to me, you came into chiropractic with a sports background. And I know you said that your dad had his own injury, but then you also had to seek out chiropractic care for yourself as an athlete. So can you tell me about, just really how you got drawn into being a chiropractor in the first place?
Yeah, absolutely. So I always say that I started kicking soccer balls and doing somersaults when I was 5 years old. So that was really the start of my athletic background. Started in gymnastics and soccer. As a 6, 7, 8-year-old, my dad got hurt playing with my sister in the backyard and was going to a chiropractor. So as a young kid, you follow your dad around and would hang out in the chiropractic office. So I would talk to patients. I would look at the therapy, the care that they were doing in the office. My mom would tell you that I always wanted to be a doctor ever since I was a little kid.
Really?
So the light bulb went off when I was in college and was making that decision of what I wanted to do. But the experience that I had with my dad and being in the chiropractic office, obviously, was able to see the benefits and the value that chiropractic brought to a lot of patients. I got hurt playing lacrosse in high school, was able to get back out on the field and playing in the next 2 days, even though I was hardly able to walk after the injury. And that was the main support that I had as a high school athlete for my junior, senior year in lacrosse, diving, playing soccer. As a college athlete, it was a foundation for my care and athletic performance was chiropractic through my 4 years of college diving at Villanova. So
how do you get into diving? Because I think about diving, I would never do diving growing up in high school and stuff like that. Did you have diving in high school, or how does someone get into diving?
So we did have a swimming and diving team in my high school. So we had a pool in the high school. It's a bit of an interesting story, but as a gymnast, my mom put me in gymnastics as a 5-year-old. It was just one of those things that we did. And I was a competitive gymnast till about my freshman year in high school. And friends of mine that were on the swimming team told the head swimming coach, who happened to be a diver for Michigan State, that they knew me and I was a gymnast. And they used to come to the gym that I worked out at and use the trampolines for training. So the diving team was at the practice one night. And the coach approached me and said, "Hey, we have a diving team. I know you're a gymnast, you go to high school. Would love for you to come down one day and just train with us for a day and see if it might be something that would be interesting."
I guess you think about gymnastics and tumbling and doing, flips and all the moves, probably translates into some of the moves and body control with diving.
Yes, and I think that's where the coach kind of was really looking at. So somersaulting, twisting techniques can be very similar. Gymnasts tend to be a little bit quicker, punchier, faster movements. Divers really learning how to use a springboard was quite a challenge, but a lot of the somersaulting and twisting techniques really translate very, very well.
Interesting. So you were getting chiropractic care when you were in high school. You continued to do that while you were a college student, and then while you were in college, that's when you decided to become a chiropractor.
Yes, so I had a friend of mine that I was trying to make the decision what I really wanted to do, and I was looking at biomedical engineering, I was looking at medical programs. A friend of mine who had graduated the year before was in one of my science classes, and I started to ask him questions as to why he was there, had already graduated, and he said he needed to finish up some prerequisites to become a chiropractor. And that was kind of a little bit of that light bulb of, hey, this has been in front of me my entire time. It's been a part of my lifestyle, and part of my own health care. And that's when I really explored different chiropractic colleges, dove a little bit more into the philosophy to better understand, and decided to apply to go to chiropractic school.
Cool. And so what kind of influence does one being an athlete, but then also a coach, what kind of influence has that had on you as a healthcare practitioner and like how you practice here?
So I really think it helped to develop the vision of the type of practice that I wanted.
Mm-hmm.
We really focus on active lifestyle. So with a sports background, practicing in sports injury management, I can really help athletes from a performance standpoint, maintaining mobility, strength, stability. But what a lot of people don't realize is when you want to be active, everybody's really an athlete. So if you want to go out and ride a bike, you want to be recreational, you want to hike, even grandparents that want to play with their grandkids on the ground and be able to get up under their own power or climb a flight of stairs, carry groceries, there's a level of fitness that you need, and mobility, strength, stability, balance, all those things that an athlete needs, you need in everyday life to perform your activities of daily living.
Yeah, my first practice, we would do a lot of corporate health talks, and we always call them corporate athletes because they still have to be physically, demanding in whatever they do, especially when they're not at work and they get out and they do physically active stuff.
Big transition that I've seen over the years in chiropractic as well is when I first got into practice, I would have a lot of tradespeople, people that would get hurt, swinging a hammer, being in, physically demanding positions. We've transitioned to a more sedentary lifestyle as well. So there's a lot more stress and chronic stress that we see. So we're treating things that are a lot different than when I first got into practice.
I mean, I think sitting on your spine, like sitting all day, is probably harder on you than bending over and digging a ditch all day.
Absolutely. Yeah. Muscles go through a functional range. They contract fully and they go through their full stretch when you're moving on a regular basis. But when those muscles are constantly contracted all day long, increases the stress level on your spine.
So yeah, 100%. I mean, but I'm curious, when you came out of school, did you have the intention of having a sports specific practice and a transition into, although you still see athletes, you see a lot of corporate people or just regular family people? Like, was that something you intended, or were you thinking I'm gonna be a sports chiropractor, but in reality you end up seeing a bunch of different populations? So
my practice has always been a general practice. So we do see those corporate people. We see people that have a sedentary lifestyle, a sedentary job. I always knew I wanted to be focused on athletes and active lifestyle. Got my certification as a chiropractic sports practitioner year or two out of school. So I knew that was always going to be a focus that I wanted to have. But chiropractic has so much value to everybody. Even if they don't consider themselves an athlete, even if they're not physically active on a higher level or more intense level, there's, again, that training as an athlete can be valuable to everybody, even if you're sitting at a desk for long periods of time.
Yeah, and the reason I asked you that is I've talked to a lot of docs, especially when we're right out of school, and the number of times people have told me, oh, I'm going to get out and I'm going to focus on this, and they think they're going to have a niche just in like sports. They realize that's actually a pretty small percent of the population. Absolutely. Like I remember I had one guy say, I'm just going to focus on, volleyball players, like sand volleyball. I'm like, this was in Colorado. I'm like, that's the thing? That's a pretty small percent. But when I was in chiropractic school, we took care of the Minnesota Vikings, where I did an internship. And when I was starting there, I asked the doctor, I'm like, well, how do you take care of like a Randy Moss or a Chris Carter, like all pro wide receivers compared to, Bob and Jane? He's like, it's the same thing. Like, they're no different. I mean, and so people are still athletic and they have physical requirements. It's not any different than treating someone that's a professional athlete.
Absolutely, yeah. I had a niche when I was practicing in New York. I've been out here in Colorado for 3 years, but I've been in practice for 25. So when I was in New York, there was about 10 to 15 years that I trained as a triathlete as well. So you start to really become familiar with the people that you train with. You create relationships with running shops and triathlon shops, bike shops, and you get those referrals and those people that are professional triathletes and also your high-level amateur athletes that are looking for a level of performance.
What kind of triathletes did you do, or triathlons?
So I've done everything from a sprint, which is your shorter distance, everything through Ironman. So I did an Ironman.
Full Ironman?
Yep.
I did a half. It's a thing, especially if you don't plan time to train for one.
Well, I was just going to say that's the biggest thing.
The timing.
The difference between training is the time commitment.
Yeah.
The longer the race, the longer hours that you're putting in from a training standpoint.
Yeah.
But shorter distances, you can be putting in higher intensity efforts as well. So there's different ranges of how do you approach some of the injuries that some of those athletes are, experiencing.
Yeah.
How do you support that? but it's all very similar. You're using similar movements, similar motions, similar exercises, just in different intensity capacities. And it's really identifying that with each individual that comes in. If a grandmother that wants to play with her grandkids needs to do squats to be able to go up and down stairs and pick up her grandkids, the intensity and the amount and the weight or resistance would be different than a professional football player or somebody that is powerlifting is going to utilize. So you go from body weight all the way up to maybe 1.5 to 2 times your weight, or changing in numbers. So we look at that. So movements are very similar, just different intensities.
Now, I'm curious because I know athletes can be stubborn, even people that are just like weekend warrior or recreational athletes. You know, at Scoliosis, one of the things that we're known for is taking care of more severe scoliosis. And although a lot of times people come in with pretty severe scoliosis and we can still help them, I always think, if we just would have got this earlier when the problem was small, how much more we could have potentially helped them or how the outcomes could have been even greater. I'm curious, when you get people that have an athletic background, do you get people in that put things off to the point until it actually stops them or it gets very difficult to do something they love? And then do you ever see like, man, although you can still help them, like if we would have had this when you first noticed anything versus trying to continue to drive on, like do you see that in your practice as well?
Absolutely. And the biggest thing is if people are attentive to what's going on and get in quicker, we can handle problems a lot faster.
Yeah.
And we can see an acceleration in the results that they're looking for. When you get that triathlete or runner that tries to run through the pain, and it starts to compound that injury. It starts to compound it. It's me too, actually. But it starts to compound that injury. You start to create compensatory factors. So your body starts to accommodate to that injury or the way that you move and allow you to continue doing what you're doing in a different capacity. So it's reversing all of that. If somebody's had a problem for 2 to 3 weeks, we usually get pretty quick results. Somebody that's been dealing with an issue for 2 or 3 years, we almost need an equal amount of time to fully reverse and get back to a level of performance.
It's interesting, right? It's been building up for 2 or 3 years, at least even symptom-wise, which means it's probably been going on longer, but you can't fix it in a couple of visits or a few weeks. It takes a while to reverse what's been going on.
So we use a lot of education in the office around that, and every patient that comes in gets a full treatment protocol, right? We are not just come in once or twice, get adjusted, and get out. I mean, we do have patients that come in on maintenance basis every 3-4 weeks. But those are people that we've made a lot of correction for and are kind of
you got to get up to maintenance.
Routine, right?
And the whole idea of maintenance, like what do you want to maintain? Do you want to maintain a high level of function, which you may not be at, or do you want to maintain a poor level of function? So you have to get to a point where you're actually maintaining a high level of health.
Right. So we have a lot of corrective care in our practice. So I had a patient that was on maintenance, came in and says, I usually go in every 4 weeks, once a month, every 6 weeks, somewhere in that range. When I feel like I need to be adjusted. And when we did an examination, we found she had limited range of motion in her shoulder, her hip had limited range of motion, there was weakness in both, an impingement in the shoulder, and said, these are some things that we really should correct because they'll become problematic later on down the road. So we really set a protocol to make those corrections and help those issues and problems, which now she's able to do things she wasn't able to do before. And we're back on that maintenance. So not maintaining that poor level of function, but that higher level of function for her now to give her more capability.
Yeah, so you guys do a few things people come in here. So talk about just the process of being a patient and what a treatment, although it's custom for each patient, but just in general, what does it look like to come here for a typical visit?
So every patient gets a full examination. We do a head-to-toe exam. Even if it's, hey, my right hip hurts or my low back hurts, we're going to do a full body exam. Spine runs head to toe. And we want to make sure that everything is, taken care of and addressed when a patient comes in. So we do a full consultation. We look at their health background as well. When we look at back issues, we don't look at them strictly as a spine or a back issue, but as a health issue. Chiropractic has a close relationship with your nervous system. So not only helping your musculoskeletal function, but can help in other health issues as well. So we want to do that full consultation. We do a full functional examination. How well does your whole body move? And then also taking into account those health issues that they've had and how it all relates. From that point, what we do is we put together a treatment plan for that patient. So we look at some of the different services that we have here in the office, and then also a frequency of treatment and duration or longevity of that treatment plan. We have passive therapies, which are palliative. So we help with pain control, muscle spasm, decreasing some of those limitations that patients get from that obvious symptom. So we help to decrease those painful symptoms that they're experiencing. Every patient gets a foundational set of exercises here in the office. So what we want to do is patients that are not active, we want to introduce them to being active. We want to create activity and exercise. Other patients, we're taking that foundational set of exercises and then tailoring it to their specific needs. And what we want to do is we want patients to build a routine. We want them to incorporate that level of activity in their life to either start to become more active so that they can do more, or to get to that higher level of performance in their day-to-day activities and be able to maintain that higher level.
Now, you said something we were talking earlier, and it reminded me of Peter Attia. Are you familiar with him? Dr. Peter Attia calls it the centenarian decathlon, which basically you look at what are the things you want to be able to do when you're 70, 80, 90, right? And if you want to be able to run, a 10-minute mile when you're 70, or you want to be able to hike a 14er or like whatever, we can just look at how we naturally regress in muscle mass and just output, and like what you can physically do. And you can work it back and you can say, well, if I want to be able to do a, say, 10-minute mile by the time I'm 70, when I'm in my 40s, I better be able to do a 7-minute mile, just knowing how much we just naturally decline over time. And so he talks about training for those lifestyle activities you want to be able to do. And you mentioned that with your patients, you look at maybe if you have a patient that isn't doing a triathlon, but she needs to be able to bend over, she wants to be able to bend over, pick up her grandbabies. She wants to be able to do, I want to be able to get up, go for a walk with my dogs. I want to be able to go grocery shopping, and I want to be able to do gardening. So you look at like some of the functional exercises that you do, and you program that based on the things specifically they want to do in their life.
Correct. Just to a few of the things that you mentioned, VO2 max is your ability to use oxygen. So if you want to climb a 14er and you want to do that at 70 years old, well, you don't want to have a VO2 max of 16 because that means you can barely get out of a chair. But if we know that your VO2 max gradually declines decade by decade and what that looks like, well, if you want to be at 20 at a minimum, we know that you need to be at 40 at when you're in your 40s and 50s. And those numbers vary. Obviously, we want a higher VO2 max is always going to be better. But hip hinges, squats, those are things that people usually think of athletes doing. Yeah. But these are things that you need to do to be able to get out of a chair, climb a flight of stairs. So we incorporate those types of activities into people's protocols.
Yep. And I think as providers, we see that all the time. But I know, like myself, I've just worked out consistently since I was younger. And I was thinking, like, man, the amount of work it takes me to be able to run a sub 7-minute mile or even like 8-minute mile compared to when I was in my 20s and 30s, even if I hadn't been training, it's crazy. Like you can just tell like how that VO2 max and how much output you can do just changes over time.
Absolutely. And that's where we want to support patients, right? Is one, educating them on those things. There's a lot of people that just don't really understand that physiology. But what does it really look like? We want to see you living to 83 years old, 90 years old, 100 years old, whatever that might be, but we want you to be healthy doing it. We don't want your decline to be at 75 and you live to 95 and have 20 years of not being able to do the things that you want to do.
I used to talk and I'd ask, who in here wants to live to be 100? And people were like, well, what does that look like?
Yeah.
Well, you determine that, right?
Absolutely.
So I'm curious, do you have a favorite or a specific patient story that really sticks out in your mind?
I do. It may not be exactly around some of the active lifestyle that we have, but and I have one or two in that capacity too. But one of my favorite stories, and this really speaks to the holistic nature of chiropractic. I remember my cousin bringing in her daughter. I was newly into practice a year or two, and her daughter came in. She had been through the typical medical model. She's
Yep.
been, has eczema, allergies, asthma, and she's a 4-year-old and been on nebulizers, medications, all these different things that we would typically think of in that, Western medicine model. And a friend of hers said, hey, have you brought your daughter to a chiropractor?
Mm-hmm.
And my cousin really hadn't thought about it, even though she was a chiropractic patient as well. We started to treat my cousin's daughter, and over the course of the first, I would say 5 to 6 weeks, we started seeing her breathing better, started to see her eczema, so those rashes on her skin, starting to minimize. She was weaning off of her nebulizer, so the medications that would help her to breathe. That close relationship to our nervous system, when our nervous system controls everything, we see improvement in that immune system. Those allergies start to subside. She creates greater tolerance.
Mm-hmm.
We treated her for about a year, and she had a few little spots of eczema. She was off of the nebulizers, off of all of her medications. So we really saw the power from a chiropractic standpoint, how we can impact people's overall health and wellness. So I think, through our conversation, we see that functional capacity, which a lot of people think of. I'm in pain. How do I get out of pain? And that's a way a lot of people view chiropractic.
Yeah.
But we can help that everyday performance, improve your longevity and your health span, how healthy you're going to be over the lifespan. But then also managing a lot of those things that people run to the doctors for medications and procedures to help with those conditions.
Well, and people don't understand, it's kind of like a car. If you only go in to get your car worked on when something breaks down or it's smoking or your check engine light comes on, and you beat the hell out of your car and you don't take care of it, like the car's not going to only has so many miles on it. But if you are working on your car and you're keeping it tuned up and you're doing good maintenance, and then you also bring it in when you have, something that's, not working, that car is going to have a lot more life and going to function at a higher level a lot longer. It's going to last you longer.
Absolutely.
Your body's no different.
Absolutely.
Right? Problem is a lot of people will take better care of the car than the bodies.
Yeah. I'm actually in a networking group and referral group, and we have a mechanic that's in there, and I used a similar analogy to wearing out your tires on your car when you have a poor alignment.
Yeah.
You see those tires wear out. And the mechanic all of a sudden came to me up after the meeting that day and said, I think I need to come in and see you.
Yeah.
And he said, I loved your analogy of if you have a poor alignment, you're going to wear out your tires. He goes, and I feel like I'm wearing out. And I feel like I need to be aligned, and I'd really like to come in and do an examination. So it's very close relationship to that in maintenance.
I mean, chiropractic can do great on relieving pain, but it's not really what it's about. I would say chiropractic is a great strategy. It's a great lifestyle strategy for people that want to be healthy.
Absolutely.
It's part of the equation, especially when
it's one of the most conservative things we can do. It's non-invasive, no medications, right? It's a very natural form of healthcare that really takes a holistic approach.
Excellent. So if you give just the average person, the patient that may be watching this, just one piece of advice, just when it pertains to overall health or people that want to stay active, what would it be?
Well, I think starting small, right? If you're not active, it's starting to incorporate some sort of movement. Starting to walk. Walking is very, very powerful, and that's something that everybody can do. You need your 2 feet. You just need to start to walk and start to build that endurance and that level of fitness just simply through walking. And general movements, range of motion. That's one of the things that we teach and educate on here is maintaining your body through its ranges of motion.
Yeah.
If you don't use that range of motion, that's when you start to lose it. That's when you start to become stiff. You realize that you can't bend down. So it's starting small with just starting to implement movement on a daily basis and creating that daily routine. If there's certain things that you want to do in life, if you want to ride a bike, if you want to go out and run, it's creating a capacity to do that where what your goal is becomes easy. If you want to be able to, you mentioned before, run a 7 or an 8 minute mile, right? You should be able to run a shorter distance at a faster pace. Or maybe at a slower pace, but learn a longer distance. So starting to think about what those activities look like and what those activities look like at 75, 80, 90 years old and reverse engineering it. And starting to just be proactive about giving yourself the ability to do more now so that you can do that later down in life. So,
Yeah. I mean, when I used to exercise and stuff when I was younger, it was different motivation. Now I'm like, I'm 45 and I know I look 35, but I think like I have a little kid at home and I have another one on the way. I think about when they're older, when they have grandkids, I want to be active with them. And there's days like I really don't feel like working out, but I will do something just with that in mind because I know how much I do like now today is what it's going to impact what I can do in 20 years.
Yep. And I think that's a big point in building that routine is even a day when you don't feel like it, that's where discipline comes in.
Yeah.
And building that routine.
Yeah.
Go out and do it anyway. Even if you don't do it to the capacity that you feel like you're performing at your highest level, that little bit means so much in that cumulative factor.
I've never regretted doing something healthy. And I'll tell patients that too. You're never going to do something healthy and regret it. However, doing something unhealthy, you almost always regret. Absolutely. And I've experienced that too. So.
Absolutely.
So, if someone's out here watching this and they're looking for a chiropractor, like first, how does someone find you and like where are you guys located? How does someone get a hold of you?
So our main location is in Lakewood. People that are familiar with the area, we're between Green Mountain and Belmar. Mm-hmm. That's where our main location is. We do work out of a satellite location at Symmetry Collective in Wheat Ridge as well. We do 1 or 2 days by appointment over there. So that's where we are from a location standpoint. Simple Google search. I think that's where really everybody, we had somebody walk in today actually just said, hey, I Googled, chiropractors in the area. But we have a website which actually makes it very easy for people to schedule in our office. There's an online scheduling tool and scheduling app for our office.
What's your website?
It's Sportive Chiropractic. So
Sportive.
Yep. SPORTIV. Chiropractic. So it's a little bit of play on cycling sportif and sportive. So
cool.
Again, very active oriented, in our practice. So our website, Google search. We are on Instagram and Facebook, so you can find us in both those locations as well.
Perfect. Well, thanks for being on the show, and thanks for sharing your background, and thanks for all that you're doing as a healthcare professional.
Well, thank you. I appreciate the opportunity to be here and be in front of everybody that's here today, and looking forward to seeing you all again.
Perfect.